Hi, today I'm going to talk to you about how to evaluate the solutions you've come up with for your project. How do you know if your solution is a good one? Charities start with the idea of helping a group, but sometimes the helping can be problematic. Let's take a look at how we can decide. Relevance, effectiveness, feasibility, sustainability, adaptability, cultural sensitivity, and unintended consequences. We will look at these one by one. First, let's look at my problem. It's called noma. It is a severe infection of the mouth and face. The direct cause is non-specific microbial organisms, but the underlying causes, or root causes, are malnutrition, poor oral hygiene, and a lack of access to health care. The target population is children aged 2 to 6 in northwestern Nigeria. So my solution is a mobile clinic with trained healthcare providers who have diagnostic tools, antibiotics, and wound care supplies for kids who are diagnosed with the disease, and a telemedicine line with a connection to local experts in a nearby hospital. That's via WhatsApp. The nutrition support will come in the form of Plumpy Nut, which is a product to give lots of calories and nutrition quickly to kids who are at risk. And they will also provide oral hygiene kits and education to kids in at-risk areas. So first, let's look at relevance. The solution should directly address the root causes of the problem and the specific needs of the target population. I'm looking at malnutrition, poor oral hygiene, and lack of access to healthcare. Here are my relevant solutions, and here are some that are not relevant. Nutrition classes, they don't need education, they actually need food. A clinic in a larger city would not help because they don't go to the large city, they're in a small village. And health education video series would not be relevant because these are not people who are streaming videos on their phones. They have a limited amount of access to the internet. So let's look at an example. We looked at the Lucky Iron Fish charity. This was intended to decrease anemia by cooking with the iron fish in the pot. However, this addresses iron dietary deficiency, whereas the target population in Cambodia was found to have genetic hemoglobin disorder, so the fish didn't help there at all. The charity needed to change its focus and look at iron dietary deficiency in other populations and work with the population in Cambodia with different solutions. Now let's look at effectiveness. The solution should have a high likelihood of achieving the desired outcomes and making a meaningful impact on the problem. Trained staff who can identify and treat cases of noma early are good because when it's early, it can be caught and stopped. Nutritional support for pregnant women, infants, and children is important because this can help prevent it. Some ineffective proposals might be relying on traditional healers who might not have the training or beliefs to help in this, providing oral hygiene education, because if they don't have the kits, then they can't benefit from the education. Here's an example of an ineffective charity called Roundabout Play Pump. This was a charity that provided children's toys that pump water for a village that is suffering from a lack of water. The children's play powers the pump, and the pump provides water. However, they were found to be difficult to maintain, expensive, and they didn't work as well as the hand pumps that they had before. This project was scrapped because it was not effective. Now let's look at feasibility. The solution should be practical and achievable given the available resources, time, and context. So we're looking at resources and barriers like financial, human, technical, logistical, political, and cultural issues. Some feasible proposals are partnering with local schools to give oral hygiene kits and training. They already provide education and have contact with the kids. This is just adding an extra service on. Collaborating with local health authorities would provide care within an existing system. They already have contact with people, they know the community, and they know how to get supplies out. Building a modern hospital in a remote village. This is not feasible. It's expensive. It's difficult to get supplies there. And there are not people in the village who are trained to work in a hospital. Let's look at an example. Socket was a charity created by some Harvard University students to provide electricity to remote villages. This ball generates electricity from kinetic energy, and then it can be used to plug in small devices like lights or phones. However, they found that it was very expensive to produce, and it broke within days or weeks, so it wasn't very useful. This was not a feasible project, and so it was scrapped. Now let's look at sustainability. The solution should have the potential to create lasting change and continue to generate benefits beyond the initial intervention period. So we should look to maintain or scale up our project and build local capacity and ownership, and avoid creating dependency on external forces like charity. Some sustainable proposals are training local community members to identify and refer noma cases. If the charity stays or goes, those people will stay in the community and they have now the knowledge to continue. Partnering with a local university to conduct research would be helpful because Now the university is building knowledge about noma and also is helping with the research for the charity. Some that are not sustainable would be a one-time large donation of medical supplies. There's maybe not a way to distribute them. Maybe there are not people there who are trained with what to do with these supplies. And a one-time visit by trained surgeons or volunteers. This can help at the moment, but who will provide aftercare? Who will treat people later? Let's look at an example. The Darfur Stoves Project provides fuel-efficient stoves to families in Sudan who are without their homes because they're war refugees. They were cooking over open fires, and it was hard to provide enough firewood to do the cooking they needed. Also, the women had to take a lot of time out of their day to go get firewood, and getting firewood in dangerous places was putting their lives in danger. So the charity created fuel-efficient, inexpensive stoves that they could distribute. People liked them, they used them, everything was going well, until they needed to repair them. Then the charity discovered they needed to train people to make and repair the stoves locally so that their project could be sustainable. They started the training, and now this charity has a sustainable model for the future. Adaptability. The solution should be flexible enough to accommodate changes in the local context and respond to emerging challenges or opportunities. It's difficult to think about what kind of changes to the project might need to be made because they're unexpected, but we have to plan for them. Some adaptable proposals would be mobile clinics that can be expanded in number or in services. If it's successful, we can have more than one, or we can expand to the different services they might provide. Proposals that might not be adaptable are a telemedicine program that depends on a specific app, like WhatsApp. What happens if it goes away, becomes less popular, they start charging for it, or people just don't use it anymore? Maybe I need to change my model. Community education that is one size fits all is not adaptable. It needs to be able to be changed to the specific needs of each village it goes to. Let's look at an example. Plumpy nut is a ready-to-use therapeutic food for malnourished children. It was produced by a company in France. It's made of peanuts, which are popular and easy to find in Africa, so it was very effective there. However, when Plumpy nut wanted to expand to Bangladesh and India, they needed to change the formula for local ingredients and local tastes. Peanuts were not available, and also people didn't know them and didn't like them. They needed to find a food that was suitable for the children in these other countries. Once they did, Plumpy nut could continue to be successful in Bangladesh and India. Let's look at cultural sensitivity. The solution should respect and align with the cultural values, beliefs, and practices of the target population. So consulting people is an important part of this. Culturally sensitive ways to do this would be partnering with local traditional healers to work with them. They already know the local people and they're trusted, so they understand the beliefs and values they have. Education materials need to reflect the local language, imagery, and culture. People need to have education materials that work for them. Failing to look at gender, family, and power rules can be a big problem for charities. And using graphic images of noma victims without their consent could break down the trust that people would have with a charity. Let's look at an example. The Friendship Bench is a culturally sensitive charity. It's a group in Zimbabwe that trains grandmothers for mental health support. They sit on a bench, people come and talk to them, they're trusted members of the community. In this low-resource setting where they may not have access to offices, they can sit in a public place, and in a place where there is a mental health stigma, it's not a problem to be seen talking to a grandmother. So this charity program is culturally sensitive and works well for the local population. Now let's look at unintended consequences. The solution should be carefully examined for potential negative or unintended consequences. We need to look at ethical risks or considerations and possible negative effects on the target population. So some unintended consequences for my project are that antibiotic distribution to children could lead to antibiotic resistance, a bigger problem. Not planning for medical waste disposal could cause problems for the local communities I'm working in. And providing food supplements could lead to over-reliance on donations or just problems with supply and demand. If my charity is providing a lot of food, then what about the people who grow and sell food? Here's an example of some unintended consequences of a charity. Mosquito nets that have been provided to help fight against malaria in many communities in Africa are now being used as fishing nets. This is a problem because the insecticide is killing fish and aquatic life, and it's also spreading toxins to the environment and to people. But if people are hungry and people have free nets, they will use them for fishing. They have to take this into account when they're designing their programs. So, do your solutions pass the test? You can use these criteria to help you decide, and then make any changes you need to make sure that your solutions are the best ones you can find. Good luck!